Hello, and thank you for tuning into Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, chair of the Division of Clinical Microbiology at Mayo Clinic in Rochester, Minnesota. And with me today is Dr. Bill Morice, the president and CEO of Mayo Clinic Laboratories.
Hi, Bill. How are you today?
I'm doing great. How are you?
Wonderful. There's always so many exciting things going on in our field. Sometimes they're, really inspiring. Sometimes they're problematic, like the blood culture bottle shortage, but, there's
Yep.
always something to talk about.
Yeah, maybe we should call our podcast "Testing in the News," because
Yeah,
there's always seems to
really.
be something about testing. And we started this with, we did it pre-COVID, but certainly with COVID, testing was in the news every day, all the news. But there's still a lot. And there was actually in the last couple of weeks, there's been another diagnostic test that and approach to testing that has caught the attention of the world and even the New York Times, and that's around Alzheimer's disease testing.
Yeah, and that's a great topic because Alzheimer's disease is fairly common. There's 55 million people living in the world with Alzheimer's, about 7 million in the US, and Alzheimer's disease is the most common cause of dementia. And I did a little reading about it. I'm not an expert, but I wanted to talk sort of about the general basics. It's not a specific disease, but it's this overall group of symptoms. And of the risk factors, age is the most common risk factor. But I think we should know that dementia is not considered a normal part of aging. So it's not a conclusion that everyone is going to suffer dementia. And
Yes.
what's exciting about this too now is that we have a better understanding of what causes dementia and a better understanding or better options for treatment.
Yeah, so I mean, look, I heard about Alzheimer's disease before I even went to medical school. Everyone said, "Oh, I knew someone that had Alzheimer's." I didn't hear dementia as much, and then actually before I went into pathology, I first wanted to be a neurologist. So I used
Huh.
to spend time on the neurology floor when I was a med student. But
Wow.
that doesn't make me an expert. But that does, I think it's very interesting to step back and say why all the energy around testing,
Mhm.
why so much interest. And I think there's a couple things that really are at play here. Number one, if you look at global health and predictors for global health, is that in the western world, as we call it, there's the real problem is aging, right? So when they project what's going to be cause the aging of our population, there's a real concern from the WHO and others that there's going to be this we're going to be really facing having to care for a lot of people with cognitive impairment, which is kind of the most correct way to say it, with some level of cognitive impairment that will really burden society. So there's a big push to say we need to do something about this. And the other thing is that there's now, as a result, there's drugs that are available. Some of them, there was the first one that came out, Aduhelm, I think that did not, got FDA approval, was very controversial, got pulled eventually. But now there are a couple of drugs that are out there that do seem to have in clinical trials shown benefit in terms of maintaining cognitive function. So there's a need to diagnose, and so all these things have kind of pushed this to the fore and really pushed the laboratory science about how do we make a diagnosis of Alzheimer's disease.
Yeah, and maybe we'll just take a step back and talk about, what do these drugs do and what is the pathology behind Alzheimer's? It's not completely well known, but there's a lot of evidence now to show that there are these two neuropathologic features that you see in the brain of people with Alzheimer's disease, dementia. So it's the presence of plaques of beta amyloid, or sometimes called A beta, and intracellular neurofibrillary tangles that contain this hyperphosphorylated tau protein. So,
Yep.
as expected, drugs targeting amyloid or tau and testing targeting these are really what we're talking about now. There's, a couple different forms of treatment, some that are more for the symptoms, but these new treatments actually remove amyloid from the brain in people living with early Alzheimer's. And like you said, they're most effective in early disease. So how do you identify those people that have early disease versus just like maybe some of the forgetfulness that people have as they get older? How do you really identify those that are at risk for progressing and having Alzheimer's where the treatment would actually help them?
Yeah, yeah, you're exactly right. And I think going back, so the two, yeah, I remember doing brain cuttings actually way
Yep.
back and looking for those those signs of Alzheimer's disease. And that's obviously not the way you want to make a diagnosis of Alzheimer's.
Right.
And so there's been a push for a long time to detect either the phosphorylated tau or the amyloid proteins. There's we can do it in the CSF, but I think the real groundbreaking thing now is we can actually detect these in the blood and through a variety of methods, immunoassays as well as mass spec. And so, but the question is, then compared to the gold standard, which is PET scanning, so which is expensive, not widely available, and not, and so an expensive procedure. So a lot of studies now coming out saying that there's high correlation between these assays in the blood and the actual gold standard radiologic findings. So, but the real question again is really stepping back. It's around the things you and I have talked about a lot, and that is how does the test perform? What is it? What is the not just the specificity as well as the sensitivity, right? Because you need both, particularly if you're going to test people early in their lives. If you're trying to pick somewhat up early, that means you want to make sure you have a pretty accurate test.
Yeah, it can be pretty scary to have a false positive diagnosis and then walking around thinking that you are going to have Alzheimer's disease. So you
Yeah.
want to get it right.
Exactly. So that's really a lot of, and we do have a clinic here, at Mayo for cognitive impairment. We're, Dr. Peterson, Dr. Graf Raffer, a lot of really well-known neurologists in the field, and I heard from them that once these tests became available, they started to see more and more people requesting appointments in their clinic because they just got a blood test for Alzheimer's and it was positive, and they're 30 years old, and so it's again, like anything, these are great. And the study that came out a couple of weeks ago showed about a 90%, specificity and sensitivity for a blood test for Alzheimer's, which sounds great. It is great. But the flip side is you still have how the test will perform still depends a lot on the clinical
That
context in which
pre-test.
is exact. The pretest probability is key here, right?
Right. Yeah. If you're testing 20-year-olds, for example, and you're getting the worried well, and, so 90% sensitivity and specificity, well, that's great, except that means that 10% are going to be false positives. And if you are a 20-year-old and your risk is very low, if you have a positive, it's probably going to be a false positive. So then
Exactly.
you have this poor person who's worried that they're going to have this terrible disease. So you really need to, it's great that people can take control of their health care and consider getting these tests done, but it has to be done in the right clinical situation, with an actual analysis or evaluation of the patient.
Exactly. I mean, that's really the key that's why we do these podcasts, is for people
Yeah.
to stay informed, right? Because it's a really exciting development. Plus the drugs you have, they're not inexpensive, I'm sure, right?
Yep.
So it's again, and there was some direct to consumer early on with some of these tests, and they're not all the same. Some perform better than others. That caused a lot of consternation. I don't think that's actually even being offered anymore because of the worried well, as you say. So it's really amazing to see in my career a disease that really we could only diagnose at end stage through physical exam. Then it became expensive radiologic procedures. But now as we push innovation in the clinical laboratory, we get to not having even to do a spinal tap, but just a blood test that can really inform a patient and their doctor that they might be, they might be developing cognitive impairment and actually being able to do something about it and improve quality years of life. And so that's all super exciting and something that's where we want the field going. But I think this just shows again, as these tests become available, it becomes even more important for us in the laboratory to be a voice about how they should be used, where they should be used, or because or else people will be misinformed. I mean, the whole purpose of the lab is to help people and their providers and their doctors make good, informed choices, right? And so we need to inform that not just on a test result, but how to use it.
Well, and you bring up an important point. It's wonderful now that we have these tests that are easily accessible and minimally invasive. But of course, that means that more people could potentially get them that maybe aren't the appropriate population for testing. So having the pathologists, the laboratory directors, the scientists, as us as lab leaders involved is really important. We know our tests probably better than any other group. And so we need to work with our colleagues to talk about when a certain test should be performed, work side by side with the patient-facing physicians and develop testing algorithms. And so that collaboration is so important.
Yep. And then I totally agree. And then the other thing is to maintain the kind of the wide angle macro view, because again, a lot of the drivers on the testing are being driven by concerns of global health and the advent of new therapeutics. And I think as we see more and more diseases become treatable through new therapies, we're going to see the lab will have to continue to keep up to try and identify, because I'm sure all of these are going to be focused on, on early detection of disease is going to really be critical, right?
Yeah. Well, while we're talking about this, I guess I will put in a plug for dementia prevention, because I've been doing a lot of reading and thought about this lately. And obviously, there's some things that lead to dementia that are out of our control. And, part of it's family history and genetics, but there are some modifiable risk factors. So getting good sleep, not smoking, healthy eating, controlling hypertension, controlling diabetes. So there's also another little public health piece out of this. If you're listening to this and thinking, what can I do to prevent my own risk of dementia? All of those things are well recommended.
Oh yeah, absolutely, right. It's interesting. I heard from an expert in this field that if you look in the blood, the use of during validation, if you have poor sleep patterns, you can see some perturbations in some of these tests. So it just shows the importance. I got a little scared because I'm not always the best sleeper. So now I'm focusing on my sleep hygiene, but and exercise. And if a lot of people worry about the genetics, that's when my grandmother had Alzheimer's, my mom had Alzheimer's. But there are things that, to your point, that we do control that can really be as important, not just for your mental health, but your brain health, but for your mental health and well-being as well.
Yeah, absolutely. So exciting times for dementia, some promising treatment, some tests to help, and then things that each of us could be doing as well.
Yeah, exactly. And I would just say, if you're really interested in this type of testing, there's a lot of good literature that's out there, and so to just go to an informed spot like a Mayo Clinic, or something like that, to get more information on what the test can and can't tell you, and then really if you want the testing, to talk to a physician and make sure you're getting it in the right context and see if it's really the right thing for you to do.
Yeah, and I'll actually put in a plug for one of our colleagues here at Mayo, Dr. Alicia Algeciras. She was the lead author on a recent paper looking at the different tau proteins and the clinical interpretive cutoffs, which are what we use in our testing here. So we're going to actually have Dr. Algeciras on a future podcast so she could tell us more of the details. But for those of you that are interested now, you can do a search for her, and we'll put a link with this podcast so that you could read about the work she's doing.
Excellent.
All right, Bill. Well, as always, it's a pleasure.
Yeah, we'll see what the news pops up next.
Absolutely. Yeah. Until next time, see you later.
See you, Bobbi.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast, and don't forget to tune in every Thursday and every other Tuesday.